Good afternoon and welcome everybody joining us in this amazing, powerful and educational Lunch and Learn. My name is Patricia Houston and I just want to remind everybody that this Lunch and Learn is brought to you by family partners of Maurice and Sussex counties. And today I have an amazing, actually I have two amazing speakers and they're gonna come here to talk about such an amazing resource that is out there. So I had Janeen Brady and Megan Brady from Senior Insurance Associates. Welcome both.
Thank you.
Thank you, thank you. And as we were discussing before, a lot of people, they might need this type of services or resources. Sometimes families or providers, they don't know what to do, especially when it comes to insurance. So how you ended up doing this and helping families and people that might need this type of information?
Sure. So I'll start with just a little brief background. Senior Insurance Associates was formed because the need for someone that actually knew Medicare, knew how to explain it, what to do with it. There was nobody doing that. So once I saw that need, formed the agency, and our focus is on education. So educating the community on Medicare, what it is, how it works, what your costs are, and really making it understood by the community. Not, we're not talking to you in the doctor's terms and all that. We're letting you see what it is and making sense of it for you.
Awesome. Thank you, Megan. Janeen?
So I'm Janeen Brady. I joined the agency a few years ago. I'm an independent agent like Megan. And what that means is that we represent lots of carriers as opposed to just one. So we can see what all is out there, what the options are, the benefits of each plan, and tailor plans specific to the need of the client.
Thank you. And definitely we recognize there is a need for this type of information, and that is the reason that we do in this Lunch and Learn. So Megan and Janine are gonna pass on this presentation to you guys. And I just want to remind everybody that this Lunch and Learn is being recorded. At the end, we are gonna turn off the recorder and we are gonna allow time for Q&A. Also, all that information in relation to contact information, website, everything is gonna be in the description below of this video. So thank you very much, and you guys can take the lead.
Okay, thank you very much for having us.
Thank you.
Give me 1 second. Okay. All right. Just want to make sure the screen is visible.
Yes.
Okay. All right.
So we're just going to do a quick overview of each slide. I'm not going to go into a lot of details. If you would like a more in-depth conversation or explanation of how Medicare works, you can give us a call and we can have a meeting with you one-on-one to go through everything. In regards to what we do not charge for our services. So there is no expense to you if you contact us or we work with you. So let's start with, we're going to start with all the parts and pieces about Medicare. So you have an understanding how it works, what the costs are, and then we're going to go into a little bit of depth about how to fill in the gaps that Medicare doesn't cover, because Medicare does not cover everything and there are some expenses. So it's important that you understand the cost and how to fill in those gaps so you're not left with no coverage and unnecessary financial burden. Medicare Part A, when you're looking at Medicare Part A, you're thinking inpatient. And if you are hospitalized, either in a hospital setting, in a skilled nursing facility, it covers your hospital stay, your doctors and nursing care while you're in the hospital. Also, if you need any rehabilitative services, you could also be eligible for up to 21 days part-time skilled nursing at home. If you qualify, it also covers hospice care. So when you're thinking Part A, think inpatient. Medicare Part A, there is no premium as long as you've worked for 10 years. The costs that you see on the screen are based for 2023. Everything in the presentation is for 2023. The expenses do change. As you see on the slide here, there are expenses, there's deductibles and copays. Those go by benefit period. So a benefit period begins the day you are admitted into the hospital and ends after you haven't needed hospitalization or inpatient care for 60 days. After that 60 days, you would start again with a new benefit period and have these expenses again. So inpatient hospitalization, you start with a $1,600 deductible per benefit period, and then you have expenses per day. Skilled nursing is covered after a qualifying hospital stay, which is 3 days inpatient, and you must be admitted within 30 days of that hospital stay. For hospice, you're responsible for 20% coinsurance. Medicare Part B. So we talked about A being inpatient. Part B is pretty much your other health expenses. That would be your doctor's visits. If you see a specialist, if you have any type of outpatient medical services or procedures, it covers your annual exams, your flu shots, and other type of vaccines. It covers diagnostic testing like x-rays, MRIs. It also covers durable medical equipment like your oxygen, your walkers, things like that. If you get a injection or medication administered in a doctor's office, that falls under Part B usually as well. Part B is not free. Premiums start at $164.90 per person. If you have higher incomes, you could be paying more, but the premium starts at $164.90. There is an annual deductible that you're responsible for. For 2023, that's $226, and you would have to pay that one time during the year. For the services, you're looking at a 20% coinsurance for all the services that fall under Part B, which would be your doctors, your visits, your preventative care testing, if you had any type of mental health outpatient services. One thing about Medicare, you're always going to want to make sure anytime you go to see any type of doctor or you use any type of healthcare facility, you always want to make sure that they accept Medicare. That's very important. Because if they don't, then you would be responsible for all the costs for your visit. So it's always important to make sure whoever you see accepts Medicare. Now, doctors can accept Medicare, but they don't need to accept the Medicare approved amount that is paid for the visit. They have the option to charge up to a 15% excess charge. And what that means is, as an example here, if the doctor's visit is $100 and the Medicare approved amount is $50, then your cost, you would be responsible for 20% of that $50, which would be a $10 co-insurance for the visit. But if they were one of those doctors that charged that 15% excess fee, they could also charge you an additional 15% on that Medicare approved amount of $50, which would be $7.50. So in this scenario, that particular doctor visit would cost you $17.50. So to calculate your premiums, they're always looking at your income. They're looking at your Social Security tax returns from 18 months prior. So for 2023, they're looking at your tax returns for 2021 to determine what your premium is going to be. The premiums start at $164.90 per person. And that's for individuals making up to $97,000 or couples up to $194,000. If you make above that amount, you could be charged higher premiums. If you've had a change in your salary where 2 years prior you made more, but you no longer make that amount, there is a form, it's called an IRMA form, that we can provide to submit so that Social Security sees what your income is now instead of 2 years back to make that adjustment on what your premium should be. So we talked about A, being your inpatient care, B, being your doctor's visits, your testing, and things like that. Now we're going to talk about what your options are, because as you saw on the previous slides, there are expenses that are not covered by Medicare that you would need to fill in so that you don't wind up with unwanted financial burden. Because with Medicare, there is no cap on the maximum amount you have to pay. So it's important to have coverage to protect yourself. So you have the option of keeping that Medicare, that original Medicare, which is your Part A and your Part B, and adding a supplemental plan, or you can go the Advantage plan route, and that becomes, it takes your A, your B, and it combines everything into one plan. So now we're going to talk about supplemental plans. So supplemental plans, you must be signed up and have your Part A and your Part B active. It covers those Part A and Part B expenses like the copays and coinsurances we were talking about. All the benefits are standardized by Medicare, so they must meet the minimum requirements, but they can offer additional benefits. The carriers that offer these plans, there are many of them, so they have to at least all have at least a minimum of benefits. There are no networks, so you can go to any doctor you want. As long as they accept Medicare, they'll take your plan. Now, supplemental plans don't include prescription plans, so that would be something that you would want to add to the supplemental plan. Here's some examples of Medicare supplemental plans. The G plan for people who are currently turning 65, that has the highest level of coverage. It covers all those expenses that you saw on the previous slides that weren't covered under original Part A and your Part B Medicare, which is those copays and coinsurances. It covers the deductible, coinsurances. The only thing it doesn't cover is your Part B deductible. And that is for anybody turning 65 after January 1st, 2020, has to pay that on any plan that they get on. There is also a little bit of travel insurance covered under there. But there are other plans that you could get that are very inexpensive that we offer. If you're going out of the country, that you could pick one of those plans up to cover where Medicare doesn't cover. The N plan would be the next highest level of coverage. And with that, you'd have copays for doctor's visits. It doesn't cover that deductible. It doesn't cover that 15% excess charge. And there is if you go into the emergency room, you could be charged a copay unless you're admitted in the hospital. Prescription plans, they're all standardized by Medicare, but they are designed by the insurance companies. They're either a standalone or they're built into your health coverage. They usually have a premium. They use tiers and phases to determine what cost is that you're paying at the pharmacy. You're not required to have a prescription plan, but if you don't get one when you're first eligible, you're going to incur lifetime penalties. You could incur them. It depends on your situation. So that's something that we tell people, that you really want to make sure you have a prescription coverage. Here it just shows you how the pricing works. There is a deductible prescription plans. It starts at it's $505 for 2023. Some of the carriers do offer help paying for that. And also some of them, if you have like a lower tier medication, which are the tier 1 is your least expensive, your tier 5 is your most expensive medication, and the rest fall in the middle. If you're on those lower tier drugs, sometimes you don't have to pay that deductible. After that, after you meet the deductible, then you're paying your copays and coinsurance until you reach the coverage gap, which at that point, it's also referred to as the donut. You may have heard that, that term used. That's when you and your plan have spent $4,660, and then you're paying 25% at that point for the cost of your medications. Once you then reach $7,400, you're paying 5% of the cost of the medications. And these plans run per calendar year, so they reset January 1st of every year. So we talked about supplemental plans. So if you don't keep your A and your B and add a supplemental plan, you have the option of picking up an Advantage plan. All those commercials that you see on TV, advertisements about benefits having free things, that's the Advantage plans. So they work like your current group or individual plans, and they combine your Part A and your B benefits into one. You still have to keep paying your Part B premium. And then you also, the same thing with the supplemental, you have to pay that Part B premium as well. With this plan replaces your A and B coverage and puts it all into one. Prescription coverage can be added to this plan. I usually recommend making sure that you have a plan that includes the prescriptions with the Advantage plans. They are designed by the insurance carriers, but Medicare sets the minimums as to the coverage to make sure all plans have at least the minimums. There are your HMOs and your PPOs. You could have networks, and you may need referrals for seeing specialists. Premiums usually start at $0, but you're paying as you go for your services. So it doesn't mean that it's free. Medicare pays the carrier, and then the carrier pays for the services. So you're paying as you go for your services. So you're paying co-pays for doctor's visits. You could be paying co-insurances. For an MRI, for example, could be $300. And then hospital stays, you're either paying like a per day or a per stay for that. They do often add little extras, like they may add a little bit of dental coverage, hearing, gym memberships, over-the-counter benefits where they'll give you a card where you can use it in the doctor's office or in the pharmacy to pick up the things that aren't covered under a prescription plan. Enrollment periods are certain times of the year when you can sign up for Medicare, like turning 65 or you're retiring. Your initial enrollment period that starts when you turn 65, it's a 7-month period that begins 3 months prior to your birth month. It includes your birth month and ends 3 months after. If you enroll prior to your birth month, your coverage would start the first day of your birth month. If you enroll after your birth month, then the coverage would begin the first day of that following month. If you're born on the first of the month, then your coverage would start the first day of the month prior to your birth. General enrollment, that's if you missed that initial enrollment period, that's a time where you can enroll in Medicare. So it begins January 1st and ends March 31st of each year. With that does not mean it doesn't apply if you're retiring or coming off of group coverage. Special enrollment periods. So these are circumstances where you've had a change in your life where it gives you the opportunity to change your prescription plan or your Advantage plan. If you are moving out of the plan area, if you lose your coverage, if you're retiring, you're losing your group coverage, there's a natural disaster. And these are times where you can sign up for Medicare. If you're losing your employer coverage, if, for example, you're working past 65, you don't have to enroll in Medicare. But when you're coming off of your employer plan, that's when you want to make sure that you do enroll in these Medicare plans, and that would be a special enrollment period for you. Other enrollment periods, annual enrollment is every year is October 15th through December 7th. And that's a time where you should always have your plans evaluated. If you're on a supplemental plan, the goal is to keep that plan for the rest of your life and not touch it. But you should have your prescription plan looked at. If you're in an Advantage plan that would have a prescription plan included, then that should be looked at, because the formularies, which are the medications on prescription plans, change every year. They may move medications into a different tier. The prescription cost could be more expensive. So it's always good to find out what is going to be a good fit for your needs at the lowest cost possible for you. Advantage plans, there are networks. So at that point, you'd be looking at prescriptions, also looking at what the coverage is, and also if your doctors are in network, because those doctors do change that as well. So it's a good time to evaluate that and make sure it's a good fit still. Changes, if you do make during that period, would take effect January 1st of that following year. There's a Medicare disenrollment period, which is January 1st to March 31st, and that's a time where you can enroll in a different Advantage plan, or you can disenroll from the Advantage plan and return back to original Medicare in a prescription plan. And if you do that, the plans would go into effect first of the following month after you do that. Okay, we do have information if there's anybody who is a veteran. We can assist you with how benefits work. We're not going to go into details about that, but just if you need help coordinating your benefits or understanding how it works, you can give us a call. And that's Medicare for you. A quick, very quick, brief, very quick scenario where we can assist anybody if they need help going through it a little bit more depth one-on-one.
Thank you, Janeen. And yes, so basically today, Janeen and Megan, what they're doing is just having an overview in here available so everybody knows they need to call, what they need to do. And then if they have further questions, you know, they can reach out to you guys and you guys gonna be able to provide additional information. So thank you for all that information.
You're welcome. Yes, it's very personal. It's not a one size fit all. What plan you go into is really determined by what your needs are. And so you want to really evaluate what you think you're going to need and take a good look, not just today, what your needs are, but down the road. Because, you know, there are scenarios where there's underwriting for certain plans and where you could either be denied from the plan or go in a higher rate, depending on which route you go. So it's important to really understand how it works so that you make the right decision for yourself.
Correct. And also, you know, when you think about insurance, it's a topic that a lot of people, you know, might have a lot of questions in relation to what is the right way, what is the right insurance, how can I do it? And a lot of things are happening online now. So I'm sure that is another struggle that a lot of families are encountering as well.
Yeah, and Medicare changes constantly. So we are constantly in trainings and getting recertified every year and working with carriers to make sure we're up on the latest information. It's very confusing. And our goal is to try to take that confusion out and put everybody's mind at ease so they have a good understanding and educate them about how things work so that they can make the decision that's right for them.
Thank you. Awesome. Awesome. And we forgot to mention that Megan's like her camera is not working, but Megan also to answer any questions that you guys might have. And as I mentioned when we started, all that information is going to be in the description below this video. So if you have any question, you can reach out to Janeen or Megan, and the contact information, everything is there. With that, we are going to conclude. Actually, we're moving to our Q&A session, and that part is recorded. Thank you very much, everyone. Thank you.
Thank you.
Thank you.